This is a video that I did not want to make, but I feel that I have to. I hope that people in the chronic pain community know that I'm on your side. I've been prescribing opioids for more than 2 decades, and I tried my best to teach medical residents how to prescribe opioids. However, sadly, for too many people in the chronic pain community, opioids are likely to be out of reach, at least for the short run. I recently released my book on opioid addiction, and I'm working on my second book on chronic pain and the need for opioids to treat chronic pain. I hope to change minds on prescribing opioids, but realistically, it will be an uphill fight. In the meantime, so many of you have asked what you can do about your pain. I'm going to give you a perspective that I think many of you may not like to hear, but hopefully will help some of you. Look, in the 21st century, we have so much improvements in medical care of everything from cancer to heart disease to inflammatory bowel disease to rheumatoid arthritis to schizophrenia. All these things have improved. However, I have not found any evidence that chronic pain patients in the 21st century do any better than their counterparts in the 19th or 20th century. Everyone is different, and some of you have benefited from epidural injections and radiofrequency ablations and spinal cord stimulators, pain pumps, etc., and surgeries. However, as a whole, I don't know that these treatments have not hurt as many people as they have helped. The question I want you to ask yourself is, what would your grandparents have done if they were in your shoes? Back in their day, they were not offered surgeries and radiofrequency ablations and epidural steroids and pain pumps and all that. For most of the 20th century, doctors have also been rather stingy about opioids as well. Now, I know that opioids help a lot of you live better lives, and I do not dispute that. However, it is also true that opioids have hurt many people through development of addiction. Now, as an addiction doctor who prescribes opioids for pain, I know that for many people in pain, opioids can be prescribed safely. However, this makes no difference if you can't get any, because I cannot make any doctor prescribe opioids for you. So what can you do? Well, keep advocating for pain patients, yes. However, I think it's also necessary that you also learn to live like your grandparents would have. Don't let pain define you. Don't just live in pain, you have to learn to live with pain. When you live in pain, the emphasis is on the pain. When you learn to live with pain, the emphasis is on living. I hope this helps.